sleep dysfunction is ubiquitously commonly associated with Parkinson's disease. So today we will discuss the practical pointers to improve the quality of sleep. Whenever you talk about any condition, the focus of success of treatment is accurate identification of the problem. Frequently I hear from the patients coming to my office, I do not sleep well. That is not enough for me to give the advice on how to improve the sleep quality. So the person coming to the doctor's office should be prepared, if sleep is a problem, to describe what are the issues. If it is problem with sleep initiation, if it is problem with maintaining sleep and frequent awakenings, do you have some kind of involuntary movements that make you wake up? Do you have vivid dreams that you act out and that interferes with sleep? Frequently the spouses will provide a lot of important information that will allow the physician to make accurate diagnosis what is the sleep problem that would lead to most effective intervention. However, at the end of the day, majority of patients will have a number of reasons why they have disrupted sleep pattern. So let's talk about some of practical pointers that would apply to majority of the patients and to non-Parkinson's patients as well. We always should start with sleep hygiene. Good quality of sleep starts with how you prepare for sleep. You should not have a heavy meal before going to bed. You should not engage in activities that will alert you, wake you up before going to sleep. We usually recommend a light supper, a relaxing walk, or some kind of relaxing activity for the last couple hours of the day before your usual regular sleep time. Let's talk about regular sleep time. It has to be regular. You should go to bed within approximately the same time of the evening so that you quote-unquote entrain your brain to be prepared to get relaxed and to get into the mode of falling asleep. Watching TV in the bedroom is not a good idea because that will alert you and again take your brain from the behavior preparing for sleep. Listening to relaxing music or a tune also can be helpful. So these strategies may help you relax and make it easier for you to fall asleep. What if you wake up in the middle of the night and have difficulty falling asleep? A lot of people say, I will click on TV and will wait to fall asleep again. This is a wrong strategy. Again, try to relax. You might try to meditate, listen to the relaxing tape, and get yourself into the sleep mode. These are some of the strategies that could help you maintain the good, healthy sleep habits. Obviously, sleep problems in Parkinson's can go beyond maintaining the good sleep hygiene, and a number of patients will need medications to maintain sleep. We usually try to stay away from sleep medicine or what we call hypnotic medications as much as possible for a number of reasons. They can be habit-forming, that they can make you feel sleepy and not alert for the next day. However, there will be a subset of patients in whom no matter what we otherwise approach non-pharmacological strategies, they will require medication, and that will be your discussion with a physician. If Parkinson's medications can interfere with your sleep and sometimes can cause acting out dreams or night hallucinations and night dreams, it's very important for the patient and for the family members to communicate those symptoms if present to the physician so that they can make the appropriate medication adjustment. Some patients with Parkinson's will have involuntary movements during sleep. The nature of them can vary. Some of them will have periodic leg movement disorder, which can be treated actually with a small dose of Parkinson's medications. So again, an important issue to communicate to the patient. Some patients will have acting out of dreams behavior, the condition called REM behavior disorder. And once that condition is accurately diagnosed, and the patients will need a sleep study, which involves monitoring of electrical activity of the brain as well as the sleeping parameters during the sleep. There are medications to control that condition, as well as adjustment of underlying Parkinson's medications, depression medications, can help eliminating or reducing the frequency of that condition. Another very frequent complaint of patients with Parkinson's is, I need to get up to go to the bathroom. Your frequency of urination is very commonly associated with Parkinson's and more problematic during the night. So again, communicating that complaint to the physician and allowing the doctor to discuss appropriate treatment measures can result in substantial improvement of the quality of sleep and improvement of the quality of sleep of the care partner or your spouse, because obviously if you need help to get out of the bed to go to the bathroom, that can be disruptive for the sleep of your significant other as well. So in conclusion, sleep problems are very common in Parkinson's disease. However, there are strategies to improve sleep, and by virtue of improving sleep, that can substantially improve your overall quality of life and your functioning during the day. Please talk to your doctors about your sleep problems. Accurately describe what happens during the night. That will help the doctor to develop the effective treatment strategy to improve your sleep.